For Action News, I'm Anna Samovska. There's good news and there's bad news about diabetes. That's according to a new article published in the New England Journal of Medicine. The bad news, the occurrence of diabetes tripled between 1990 and 2010 in the U.S. Of course, we know that obesity prevalence also increased during that time. But here's the good news. The rate of major complications like amputations or cardiovascular events dropped significantly in that same period of time. ACTIA's Dr. Ruth Kava explains why neither news is surprising.
Even though the number of diabetic people, that is, the number of people who have been diagnosed with diabetes, actually tripled between 1990 and 2010, that is over a 20-year period, the rates of all of these complications decreased significantly by 51% for amputations, heart attacks dropped by 67%, stroke by 53%, end-stage renal disease by 28%, and hyperglycemic crisis leading to death by 64%. So this is major news. This is very good news. And these were based on national surveys of adults over 20 years of age who had been diagnosed by their physician or other healthcare provider with diabetes. Probably, considering the age, most of them were diagnosed with type 2 diabetes. The bad news is that we have a lot more people who are diabetic. So whether this good news will hold in the future remains to be seen. But I think that this emphasizes how important it is to pay attention when you have diabetes to controlling blood sugar and controlling the risk of these complications. I think that people are paying better attention to treatment paradigms, what's necessary for treatment. And it's also probably that awareness of diabetes has increased. Now, it may be different in different subsets of the population, different ethnic groups that are more or less prone to diabetes. But on the whole, the news is relatively good that we are controlling it better. Now what we have to do is control the cases of new diabetes, and we can do that, hopefully, by decreasing the rates of obesity in the population, because that's a major risk factor for diabetes, especially in some susceptible subgroups.
And to read more on that story, and others, you can head to our website, actia.org. That's acsh.org. And while you're there, don't forget to also sign up for your daily dose of news delivered right to your inbox. For ACTIA, I'm Anna Samovska.